Hello everyone, I'm Dr. Anita Reddy, Professor and Head, Department of Speech Language Studies and Vice Principal at Dr. S.R. Chandrasekhar Institute of Speech and Hearing. The Department of Speech Language Studies is conducting an awareness campaign on World Head Injury Day, which falls on March 20th every year. As a part of this initiative, we have requested a renowned neurosurgeon to participate in this campaign to create an awareness to the general public on traumatic brain injury. Dr. Jacob Alapat is a senior consultant and head of the Department of Neurosurgery at Aster MIMS Hospital, Calicut, Kerala. He has vast experience in the field of neurosurgery and his areas of interest are acoustic neuroma, aneurysms and endoscopic surgeries. We have requested Dr. Jacob to opine and advise on traumatic brain injury.
Thanks for the introduction. Honestly, I should congratulate the Department of Speech and Language Studies, S.R. Chandrasekhar Institute.
So now moving on to the interview session. So sir, head injury has become a household term in our contemporary society. Is there a difference between the way a layman uses it and the way it is conceptualized by a professional?
That's a very true question. Head injury is but a very common term a layman uses. Is head injury synonymous with brain injury is the question. Head injury happens when you have a scalp injury, when you have a fracture of the skull, when you have a scalp hematoma, when you have something falling on the head and you have an injury. But that does not necessarily mean that your brain has an injury. So what are the indicators of brain injury? The usual indicator or the most cardinal indicator of a brain injury is loss of consciousness. If somebody loses his consciousness, it is a clear indicator that he has got an injury to his brain. This can be further thought about by two things. You always ask him, or you often have seen that patients will lose their memory after the injury. So this can be divided into two things. This can be divided, the point of fixation is the accident. Antegrade and retrograde amnesia. Retrograde amnesia is one where the patient loses his memory which has been recorded in his brain before the accident. You remember the film Moonambira, the old film where Kamal Haasan and Sridevi plays a very important role and Sridevi forgets Kamal Haasan after the accident. That is retrograde. The duration of retrograde amnesia has got a bearing on the severity of impact of head injury. That's why many a time people forget their past and everything after a serious head injury. Antegrade amnesia is, and that is more important, as I said, retrograde amnesia. Antegrade amnesia is one from where the accident has happened towards. He is not remembering when the accident has happened. He is just remembering, then he is remembering back only when he has reached the hospital or he is in the ICU like that. So these are the two types of amnesias. Both indicate that there is brain injury. Or more clearer indications of brain injury are patient has got a weakness, deficit. Patient has got a seizure or a convulsion. That all indicates neuronal activity. So these are all definite indicators of head injury, which commonly used by laymen but professionally used as brain injury.
Well, that adds to a lot of clarity to the term now, I believe. So sir, generally we know that there is a robust relationship between road traffic accidents and head injuries. What are the other conditions that may cause head injuries?
As we know, road traffic accidents are the major cause of head injury or brain injury. It is sad that still we lose a lot of lives on the road due to head injury because of accidents. And definitely this is happening in the most productive age, the breadwinners of the family, and at an unexpected time. and the whole family is shattered. Their income is gone. They have to support and take care of this breadwinner, the young man, and there starts the break of economics, the break of public care. And I have often heard people saying, when I'm not wearing a helmet, what is it you are? It's my head. It's wrong. Because if you are sick, it is the public expenditure of taking care of you that is happening to you. So nobody can say that head injuries is something that should happen or it is preventable. That is the message I have to give on this head injury awareness month. You should wear helmets. At the very beginning itself, I am starting on that. Properly wear helmets. Quality helmets. Even if you are going for a short trip. I will have a lot of stories to share of people thinking that I'm just going to the next shop, why should I wear a helmet? And ended up with a major accident and ended up losing their life. If not losing their life, in persistent vegetative state or severe disability, non-productive life which is dependent on others. So helmets, seat belts and safety. See, apart from road traffic accident, see if you see accidents which are the most common are fall from height, climbing on electric posts. Many time electricity board people will not use the safety measures. Working at tall buildings without safety measures. Climbing trees, and during holidays, children are always trying to pluck mangoes and other jackfruit and falling from the tree and ending up not only with head injury, spinal injury, which is again another different area where they are helpless, lower limb and upper limb. I mean, both paraplegics or quadriplegics. These are all very painful things in the society once, which are preventable if you have one concept: safety first. Think and do. Think first and then safety will come to you. So before you do an act, definitely you should have that concept that am I doing it safely? Am I putting the helmet? Am I using the seat belt? Am I using the phone? Now these days a lot of cyclists have increased. Cyclists going without helmets, because in our country we do not have cycle tracks. We do not have cycle tracks. So you are riding in the common road with the rest of the vehicles. So you're more injury prone. And again, we do not have heavy traffic lanes, which are separate in most of the well-developed nations. So these heavy trucks which have been driving over, and these drivers may be careless, they will not be able to see as we drive smaller vehicles, and these two-wheelers which are the most prone or vulnerable group along with the pedestrians. And our country do not have a civic sense or a traffic sense in that matter. We do not respect the pedestrians, the zebra crossing people. We do not give time, because our country is very largely populated, thickly populated, and lot of people on the road, on two-wheelers, on the foot, like pedestrians, while going for their work, coming after their work, wanting to reach their homes. Everybody is in a hurry, and accidents are more prone and more commonly happen during the key peak hours, and during late night, and during festival time, and under the effect of alcohol. All these are preventable. If you are to go to a destination and reach there, why don't we start early and then go relaxed at a lower speed and reach safely? That is more important. And especially the youth, the younger people who are not looking into such matters end up with accidents.
Well, that was very informative, sir. So most often these head injuries are associated with overt symptoms like loss of consciousness, bleeding, vomiting and etc. Apart from these cardinal features, what are the other signs and symptoms which are indicative of head injuries?
The usual symptoms of head injury are headache, vomiting and loss of consciousness, as I already told. Apart from this, the patient may be deeply unconscious with a weakness of one side. Patient not be breathing properly. Patient may be having seizures, convulsions as I said. So all these plus bleeding from the nose, bleeding from the ears, ecchymotic or dark blood-colored patches on the back These are all indicating base of skull fractures. There may be scalp injuries, depressed fracture of the skull, and these patients may be deeply unconscious. So this is the importance of ambulance services. The golden hour is the classical description. Whenever this patient can be taken up more safely, transported safely to the best nearest hospital, you save lives. So our country again is slowly improving in ambulance services. We have to accept that ambulance services and ambulance calls have definitely improved than 10 years before, and these patients are quickly taken to the nearest hospital with all the facilities for treating head injury patients or polytrauma victims. And whenever they reach the hospital also has got a very fast track for dealing with these patients and saving lives. But again, the message is that it is better to prevent head injuries than to treat them.
We all know that head injuries may vary from a minor injury to a major one. How can one differentiate between the two?
Head injuries can be mild, moderate or severe. A great team of neurosurgeons in Glasgow General Hospital, UK, Teasdale and Janet, were the first people to give a very good clinical observation scale called the Glasgow Coma Scale, GCS. This is a scale that was introduced by Teasdale and Janet for not doctors or nurses, but for healthcare workers, peripheral ambulance services people, to communicate between doctors what is the severity of head injury. So in that is the most commonly used scale for assessing the severity of head injury. So any score of 15, 14 and 13 is taken as mild head injury. Anything between 12 to 8 is taken as moderate head injury, and below 8 is taken as severe head injury. So if somebody says or communicates that it is severe head injury, it indicates his Glasgow Coma Scale is below 8. Although in common parlance we say severe head injury, he has got severe head injury, it means that his GCS is below 8. And such patients are often intubated, ventilated and put on paralyzed or taken up for surgery depending on the CT scan findings. Many of these, you should remember, many injuries in the brain are not reversible. The contusions of the brainstem, the diffuse axonal injury, which all has to be naturally recovered. But there are certain surface hematomas, the hematomas that happen on the surface of the brain, the extradural hematoma, outside the dura, the subdural hematoma, or certain contusions, or now the so-called decompressive craniotomy, where a bone flap is removed to decrease the intracranial pressure inside the skull and kept in the abdomen, are also a very major surgical procedures undertaken to save the patient or trying to reverse the process of injury of head injuries.
Some individuals are more prone to head injuries compared to the others. For example, it's interesting to know how sports can contribute to head injuries. Do you think there is any variation in terms of the occurrence of head injuries with respect to the age, gender, and occupation? Could you highlight on the population who are at higher risk to develop head injuries?
Obviously, the male-female ratio of head injuries, males are more prone. They travel more, they go for work, they are usually the drivers, and usually the young, productive male members of the family are hit. And the family is just thunderstruck at that moment. And often we think, this is a very famous quote by a very famous neurosurgeon, not me syndrome, that it will not affect him. It can affect anybody in this world. It can affect anyone in this world. Often when it affects you only, you remember. Otherwise it's only a newspaper item for you. You read and forget. But the aim of this presentation itself is to improve the civic sense, the traffic sense, and the importance of observing traffic rules and being safe in your life so that you are protected, the society is protected, and rest of the people are also. If you do a drunken driving and you hit somebody else who is suffering, not only you, the other people also are affected. So it is important that on such days, as I said already, these festival days where people crowd, people start moving from one place to other, you take your time to start early and reach your destination. You do not do night driving. Night driving is often unsafe because you tend to sleep. Even the other driver, if he's not driving properly, you are vulnerable. So please understand that you should do your driving and your habits in a safe manner. If you are walking on the road, there is a responsibility even for the pedestrian in that matter. He should not do jaywalking. He should cross the zebra lines carefully, only when the traffic signal and light is allowing you for a green crossing of the pedestrian.
Well, those were some very interesting facts, sir. So, coming back to the question, an individual might sustain different types of injuries, for example, bone fractures, burns, etc. But why are head injuries considered to be more damaging and difficult to manage compared to the other injuries?
Why is head injury so important? You may have fractures, you can fix it up. You can have an abdominal injury, you can operate and stop the bleeding. But a head injury damage is not reversible. Take it from me, after a head injury, a personality is not the same as he was before. When you see the outcome of head injury, it is often divided into 4 sets. One is death. Okay, one has to die. But the second, the persistent vegetative state, the most pathetic state where you lie like a vegetable and you are not productive and the whole family has to look after you. Third is severe disability where you cannot go back to work. You are still not independent, you are dependent on others. Moderate and mild disability are the ones where you can go back, but you will not be the same. Your memory, your cognition, your function, your everyday activity will be affected. So a head injury is very, very important, and the best method, as a neurosurgeon who has worked for more than 30 years in this field, I feel prevention of head injuries is the key. Just like in all diseases of human mankind. In head injury also, our first aim is prevention and then treat.
Alright, sir. So I think it's important for us to know the statistics of these injuries in India. So how prevalent are head injuries in India?
The incidence and data of head injuries and other road traffic accident is often released by a body called NATPAC every year, and they very well maintain the data of each state, each district, and it is only rising every year. It has never fallen, the data has never gone down. Maximum it has stabilized, and the states like Maharashtra, Karnataka, Kerala are still rank high in these. Anybody can refer into these NATPAC data and get into the statistics. Statistics do not matter for me in that. If you are the affected person, it is 100% involvement. And in cities, as you know, if you are hit and if you are taken to the big or corporate hospital, unless you are supported, it is very difficult to meet the economic burden of such hospital care. And it is very important that the public hospitals of this country are empowered and having more efficient system to manage these patients. And who will take the toll of it? Because when you have more accidents, there will be more patients in these public hospitals, and the degree of care and the lack of care will come out. So if you decrease the number of accidents, the hospitals will not be flooded with these patients, and there will be more better patients here. And as we all know, this year's theme for head injury or brain is COVID-related brain injuries. This is happening both in head trauma and stroke. definitely COVID had a big impact on the economy of this world, of our country and of our state. And COVID being a very disease that is neurotropic, that is why it is affecting the brain. It is affecting your smell first, and the association with COVID and intracerebral hemorrhage, association with COVID and stroke are all being now coming more and more into importance. So we know this is very, very important, and to take vaccination and protect yourself by using mask, hand rubbing and this social distancing is still important even after we have started vaccination. And that is the theme for 2021, protect your brain, mind your brain, and brain related injuries and problems of COVID.
COVID-19 has changed many aspects of life. During this pandemic, there has been a mercurial hike in the prevalence of child abuse as well. This has been reported by the print and electronic media and also has been quoted by our Honorable Supreme Court Judge, Justice M.V. Ramana. So in this connection, could you sensitize us all about the child abuse and shaken baby syndrome and also its role in head injuries in a highly vulnerable population like children?
Obviously, I have not spoken about pediatric head injuries. Pediatric head injuries are a different cup of tea. But we are seeing from data and we are seeing from the press and media that because the kids are forced to remain at home, not able to go to school, not able to interact with people, these kids are having lot of psychosocial problems. Not only the kids, the parents, the caretakers, and there is an element of more pediatric injuries happening inside the house, inside their premises. And in this relevant, I will say, although this battered baby syndrome is described, it is much lesser in our society. It is still there. It may not be recorded or going noticed by our authorities, but the changing trends in the society of the family, the structure, social ethics, all these are slowly bringing it up. Some battered baby syndrome, employed mothers not getting enough time, employing the ayahs for take care, all such situations are there, which are slightly increased in the COVID times. And this is also important because pediatric head injuries are, as I already said, is a different ballgame. And one looks upon a pediatric head injury by the combination or with the help of the pediatrician, and the management is slightly different than adult head injuries.
So that definitely gives us an understanding as to how vulnerable or how potentially at risk even children are to developing head injuries. Now moving on to the hospitalization and its procedures. What is the importance of hospitalizing a head injured individual?
Often a patient comes with a road traffic accident. He comes to the hospital. He is fine. After the accident, he has a loss of consciousness. But it is always safe to observe a head injury patient for 24 hours. Because anything, a fully conscious patient may suddenly become unconscious. I have a lot of stories to share. And as the great wording is, no head injury is severe enough to be despaired of or let off, or mild enough to be not to be taken care of. So whether it is mild head injury or moderate head injury, patient should be under observation, in a hospital where there is a neurosurgeon, where there is a CT scan. So often asked question, what are the indications for admission in head injury? Loss of consciousness, fracture skull demonstrated, CT scan demonstrated, injuries inside the brain, or a patient with seizure disorder or convulsions. All these are indications for hospital admission. And one should remember that these patients are often segregated and separately kept in the so-called head injury ICUs in the first 24 hours to a varying duration depending on the progress of the patient. And that ICU is always kept with lot of aseptic techniques, with lot 24-hour coverage by doctors and nurses, and individual patient care has to be at a higher level with almost 1:1 patient-nurse ratio.
Well, that was a great outline about how a hospital functions with respect to treating individuals with head injuries. Many head-injured individuals may lose their lives due to lack of awareness as to how to handle them. For example, excessive crowding around the injured, feeding or giving liquids at the time of the injury, or also the improper positioning while transporting to the hospital, etc., which may worsen the condition of these individuals. So what are the important measures to be followed by the public while transporting or while rescuing these victims?
An often asked question is, I see an accident on the road and what is the first aid I should do? This is a common scenario that one can face many a time. Another sad thing is that people, once they see an accident, run away from the accident and make sure that you are not anywhere there and do not try to help the accident victim. It varies from place to place and social structure to social structure. If in a village or in a town that's less developed, I'm sure people will rush to their help. But that rushing people should not do more harm. They should not try to excuse the victim or the patient or the person who is traveling out in an unstable situation. One should take the patient carefully, mobilize, not mobilizing the neck, not mobilizing the spine as a stiff thing. The best thing is, if there is a doctor or a medical personnel around, give him the lead. And you can call the ambulance by the time, turn the patient's head to one side or the body one side so that he is not aspirating his food contents or stomach contents. And once the ambulance comes, the ambulance caretakers will do the rest of the deed. But till then, you be careful, put him by the side of the road. There was a story once, actually, a person outside India had an accident in one of the cities in Kerala, and he was traveling in an auto rickshaw. The auto rickshaw hit another vehicle and was in accident. He was pleading, "Don't touch me." He was crying out when people were trying to take him out of the road, "Don't touch me." He was lying on the road until the ambulance came. So he was safely transported by putting him on the frame and wrapping him perfectly, and that is very important to prevent secondary injuries. Just like as I said, the golden hour, the first hour, the primary injuries are the injuries that happen with the impact. The secondary injuries are the injuries that happen after the impact. Secondary injuries include even when this patient is taken in an ambulance, the ambulance driver is trying to speed and hit another vehicle. That's a kind of secondary injury. So the classical secondary injuries in medical parlance are hypoxia, hypotension, hypothermia, hyperthermia, electrolyte imbalance, hyperpyrexia. So all these are the secondary injuries which should be ideally prevented by taking the patient early into a proper head injury unit.
I'm sure that would have been an eye-opening information for every individual who is trying to help someone who is severely head injured. So, moving on to the next question, what are the priorities in managing a head injured individual?
Any patient involved in a trauma, or having head injury or not having head injury, having other injuries, should be very quickly taken by the ambulance team to the nearest major hospital. And these days we have the emergency department, the critical care team, taking care, receiving these patients into their ED bay and resuscitating these patients. Head injury per se may not produce a BP fall, but if a patient with polytrauma has BP fall or hypotension, it indicates that he has other injuries. And often and always, this BP correction and hypotension correction takes priority simultaneously with head injury management. So this patient, as their BP and vital signs, the pulse, BP and respiration is stable, the ABC is stabilized, they are taken for a CT scan. A CT scan is a basic investigation in head injury. These days, when minor head injuries come also, we sometimes ask for a CT scan at least before discharge after 24 hours of observation. In such situations, it is always better to be on the safe side, not to miss patients, not to miss lives, and doing a CT scan, if indicated by the treating neurosurgeon, is better done, and then according to his advice, you do further accordingly.
In circumstances where a neurospecialty unit does not exist, what are the other alternative modes? Can telemedicine be a viable option?
In an acute setting, telemedicine may not have much relevance, but still in centers, before you want to transport a patient to a center where there is neurosurgical or CT scan facilities, you can communicate with using telemedicine and with the neurosurgeon and shift airlift or helicopter lift or ambulance lift of these patients. This is all practiced in certain remote places where you do not have facilities and the available facilities kilometers or miles away. So in such situations, telemedicine may play a critical role in transferring these patients. But you, as you know, you cannot do any treatment through telemedicine. You can give some advice and how to proceed situations.
We know that brain is the motor control unit of the whole body, and any insult to the brain may also disrupt the harmonious functioning both physically and mentally of the individual. Therefore, this might also require input from many professionals. So, according to you, who are the professionals who are involved in enhancing the quality of life of these individuals?
The prognosis of head injury often depends on the severity of injury. As I said, the severity of primary injury, and you do not allow any secondary injuries to happen. But what has happened in that primary impact, nothing or nobody can replace. That is why I am against stretching that point or stressing that point of prevention of head injuries. What is lost after a head injury cannot be got back. A lot of, as the brain is such an important function, we know very little about that master organ, and every part of the brain has a very important function, and what we will lose after an injury is very interesting. So whenever you have an injury in your left hemisphere, you have a chance to lose a very important thing, that is your language, your speech, and that is, you know, the Wernicke's area, the motor area, the conduction bundle between them, and the association areas, and all these, if injured or disturbed, will affect his speech and cognition. The right hemisphere is equally important for rest of the aesthetic functions. Our right brain is the thinking brain, and the right brain is the emotional brain, and the left brain is the intellectual brain, and both these brains has to work as a unit for a human being to be intelligently functioning, efficiently functioning in all his spheres of life. So often we see there is lacunae after an injury, and what is lost cannot be replaced. For example, simple things like a minor head injury, loss of smell. And when you lose the smell, you lose the taste. It may not recover for all people. So losing smell by just disruption of the olfactory striae may end up in a decrease in the quality of his life. Second is hearing. Hearing, when there is fracture of the petrous temporal bone, especially transverse fractures, when there is bleeding from the ear, the eighth nerve is cut or injured or contused, and you lose hearing in one ear, and nobody can replace it. Then eyesight, I need not say, often we see head injuries associated with optic nerve injuries, and if you lose one eyesight, your depth of perception, your vision, you can never take up many professions in life. Many young people have similarly lost their future. So all these special senses, our sense of taste, hearing, smell, eyesight, everything is in and around the brain. And when you lose any of them, you can never be back to normal, what you were before. But of course, we are fighters, we have to go ahead, we have to leave ahead. And for that, we medical professional people and rest of the people will help by speech rehabilitation, by swallowing therapy, by hearing aids, by other methodology of newer technical, digital things. But it will never be the same as the way that great God created. So what is lost is lost. We cannot replace the way, as again I stress, the way that God created.
How do you generally prognosticate these individuals with head injury? Because in many cases, the individual may survive the head injury or may recover from the adverse effects of the same. Is there a possibility that one can expect about developing illnesses related to the old injuries? For example, like in the case of the famous boxer Muhammad Ali, who actually stood resistant to punches, but however there was a regression in his health condition over time, due to which he has developed Parkinsonism.
See, after a head injury, if you see a post-head injury patient, he will be on many a time drugs to prevent seizures, anticonvulsants. He will not be able to walk or talk the same way. He will not have, some people may develop because of the injury to the deep basal ganglia structures, extrapyramidal-like features. That is where they develop Parkinsonism. And then you all might have heard about Muhammad Ali's pugilistic dementia, that is Punch-Drunker syndrome. All these are because of the injury to the brain or repeated injury to the brain. And this is all restored by a big branch of the medical profession, the physical medicine and rehabilitation people. It is such a wonderful specialty who take care and rehabilitate physically, mentally, these people back to normal life. And the yeoman service these people put in, working on these people for hours and hours together, cannot be underestimated. And often they are the continuum of the good clinical care we take and bring back the patient to normal life.
Well, that adds to a great perspective about team approach, sir. Most often, the individuals who suffer a head injury might have been a breadwinner of their family. So, in such cases, how can they be financially supported?
Very often, you have got MACT Act, that is the Motor Accident Claim Tribunal. where these patients will have to go. They will have to be assessed by a team of expert doctors, committee which assesses their disability, and they will get some form of financial support, aid from the insurance sector, from all other schemes of the government. And in this point, let me tell, we are always trying to help these patients and err on the positive side so that they will get more help and more benefit out of these schemes. But that does not mean we will cross the limits of honesty and transparency, which is very important in these situations. And the judiciary has to play a very critical role in the frame of these laws, and state has also a very important role to play in helping these patients by change of our legislator, rules and regulations for the routes and regulations by the transport authority, the strictness and enforcement of the law by the government officials, police, all are very, very important. It is a big chain, starting from the smallest person in the society to the highest authority in taking care of these patients. The role played, there is civic sense behind, and the responsibility behind is beyond explanation on a talk in words.
It is assumed that prevention is a multi-dynamic approach with respect to the different domains of risk and the different groups. So what are the precautions that you would like to suggest to preventing the occurrence of head injuries? Is there a particular take-home message that you would like to give our audience?
Let me end this small video and presentation by again re-emphasizing the importance of preventive measures in head injury. As a neurosurgeon who has worked for long and got fed up mentally and physically by seeing the poor state of a serious, severe head injury patients, I have often felt that prevention is the only method to prevent these serious head injuries. And how to do it? By wearing helmets voluntarily, both the rider and the pillion rider. Even the children. I often, when you went to Sri Lanka for a conference, I saw there the school was being left. All the mothers are bringing in small helmets to keep the small helmet on the baby's head and then take them home. I was really surprised. So helmets for two-wheelers are important. Number one. Seat belts for the four-wheelers are important. Front and behind passengers, all four passengers. Third, the good safe roads with well-marked roads, with all accident-prone curves, lighting on the road, all these measures taken by our national road safety authorities. And I am looking for a good civic sense for the drivers, the truck drivers, the pedestrians, and show respect and importance to life, importance to human life on the road by respecting the people who are walking. Just because you are rich and you have got a big car, you cannot drive it the way you want. You should be considerate and benevolent enough to think that their life is equally important as my life. So, a country which is economically progressed or progressing like us in the future will have such safe roads with a decreasing trend of road traffic accidents, and hope we will have such safe roads under the efficient governments that are ruling us and we will be safe on our roads just like many other countries, and the statistics will be better than the past years. Thank you, Jai Hind.
It was indeed a great pleasure to have you in this platform, sir. So, before winding up, I would like to thank Dr. Jacob Alapart, who is one of the most eminent personalities of neurosurgery in India, for having agreed to conduct this session by taking time from his busy schedule. To my surprise, I received all his videos well before time, regardless of the possible technical glitches and hectic schedule. This video was a humble attempt to sensitize the lay public about a topic of a very high priority. I'm sure Dr. Alapart's dialogues that is embedded in his rich experience and uncommon wisdom as a seasoned consultant would enlighten those who watch this video. On this occasion, I owe my sincere gratitude to Dr. S.R. Chandrasekhar Institute of Speech and Hearing for having provided this wonderful opportunity. On top of everything, I'm thankful to Dr. Anita Reddy, our beloved HOD, for entrusting me with this interview. On this occasion, I would also like to sincerely thank everyone who has directly or indirectly contributed in making this session a successful one. Thank you, one and all.